Welcome everyone. Today we'll be exploring the clinical relevance of electrolytes and how they play a critical role in clinical decision making. While this module isn't required part of our curriculum, it's designed to build on our discussions about sensor technology and provide deeper insights into how electrolyte levels are monitored and interpreted in real-world clinical settings. By understanding how these values guide treatment decisions, we can better appreciate the practical applications of the concepts we've been studying. So let's dive in and see how this knowledge translates to improved patient care. Electrolytes, such as sodium, potassium, and calcium, are essential for maintaining key physiologic processes, including nerve conduction, muscle contraction, and fluid balance. Even minor imbalances can disrupt these processes, potentially leading to serious clinical consequences. For example, hyponatremia may point to conditions like heart failure, while hyperkalemia may signal acute kidney injury or adrenal insufficiency. By carefully interpreting electrolyte patterns, clinicians can gain valuable insights into a patient's overall health, guide appropriate treatment decisions, and prevent further complications. This presentation will explore the significance of electrolyte monitoring, highlight common disorders, and demonstrate how these findings can influence clinical care planning. Electrolyte levels can be measured using various electrochemical techniques, each offering unique insights into ionic concentrations and behavior. We have seen this figure in an earlier presentation, and currently we focus on potentiometric measurement. This method measures the voltage difference between two electrodes in an electrochemical cell to determine ion concentration. It's based on the Nernst equation, where the potential generated by the ion-selective electrode, ISE, correlates with the activity of a specific ion. Potentiometry is widely used for measuring electrolytes such as potassium, sodium, and chloride in clinical settings due to its precision, simplicity, and reliability. The advantages of it are high specificity, minimal interference, and rapid results. Returning again to the so-called sensor block presented previously, this makes clear that in this session we'll focus on potentiometric techniques, which are the gold standard for clinical electrolyte measurement. As mentioned before in the introduction, we'll explore later in Module 11 the role of ion-selective electrodes with electrochemical transducers and how they provide accurate and rapid measurements that clinicians rely on for decision making. To bring home the clinical relevance of these measurements, let's take a look at 3 clinical cases. Case 1. Frances, a 78-year-old that lives alone, is admitted to the hospital with a chief complaint of weakness and confusion. She has a history of atrial fibrillation and chronic heart failure. She's taking several at-home medications, and one of the questions may be, does she understand what these medications are for and what the impacts are? That's a separate discussion. But she presents neurologically confused, slow to questioning, general weakness, and trouble focusing on her vision. She also has some cardiovascular activity here, a blood pressure of 100/59, heart rate of 55, which is irregular, peripheral pulses are weak, and the EKG, of course, as we know, indicates atrial fibrillation with controlled ventricular response. Pulmonary respirations are 12 per minute, which is considered shallow, and the skin is decreased turgor, dry mucous membranes. We did receive a partial lab report for this patient, and that is shown here. And in this case, like many, we're just using to illustrate the practical importance of electrolytes in clinical care. It's really not expected knowing the cause-effect as part of this module. But here you can see the basic electrolytes and what the test is and what the normal range are. And the interpretation of these can help the clinicians make decisions about patient care. In this case, what is remarkable or important elements of this patient report? What would the electrolytes tell you about the patient condition? Are the ranges narrow? Narrow electrolytes means care in terms of dispensing medications. And what is the significance of knowing about the at-home medications? Who's providing the care for the individual? So basically, here, A primary requirement of the sensors is to maintain a high degree of specificity for the intended analyte in the presence of potentially interfering chemical species to avoid false positive outcomes. That is to say, we need to be able to profile these and understand what the species are and their levels, and normal ranges, of course. So the inquiry is, for instance, the furosemide induced electrolyte imbalances and metropol to a lesser extent. So these are important things to know. If the blood urea nitrogen is high but the creatinine level is low, the main reason is dehydration, not acute renal failure. If it's acute renal failure, you're both going to have both high creatinine and high BUN. So the ratio is normal, but the levels are high, and that might be indicative of renal failure. And in the case of this idea is that you've got the potassium, sodium, magnesium, they're all low, but you've got an elevated BUN. Okay? So basically what happens is the clinician looks at this, and the diagnosis as a result of looking at the labs is this individual has metabolic alkalosis, hypokalemia, and hypomagnesemia, and then there's a fluid volume deficit, which means basically she's dehydrated. Case 2. Mr. Johnson, 68-year-old, has been vomiting and has had diarrhea for 2 days. He complains of being dizzy. His nurse assesses his physiologic status and notes that his muscles are weak, his abdomen is distended, and bowel sounds are absent. Wouldn't expect you to know necessarily what the condition is, but the pattern would be that there's an electrolyte imbalance, in this case, hypokalemia. Other typical symptoms associated with this electrolyte imbalance are weakness and fatigue, muscle cramps, palpitations, constipation, and arrhythmias. All of this aligns with some of the things we see about this particular patient. The treatment would be oral or intravenous potassium and EKG monitoring for signs of cardiac arrhythmias. Of course, the potassium changes can exacerbate arrhythmias. Blood tests to check for potassium levels and other electrolytes that might be disturbed during the process of care, and of course to suggest dietary supplement of potassium-rich foods such as bananas. Again, just the point here is to point out the importance of measuring an electrolyte in terms of diagnosing and providing patient care. Case 3, elevated sodium level. In this case, an elderly patient has just been admitted to the emergency department with symptoms of confusion and muscle tremors. When taking his history, it is revealed he has been discharged from the hospital 2 days ago. He has been on IV therapy for a stomach virus, but could not keep fluids after he was discharged. So this is a patient that's been discharged to home and now is readmitted to the emergency department. There's some patterns here, of course, and as you might expect, there's an electrolyte imbalance, and this is hypernatremia, of course, so low and high can have significant effects on patient care. And other possible symptoms associated with this electrolyte imbalance are dehydration, tachycardia, irritability, and restlessness, and of course, low urine output. So what would be the treatment? Obviously, increasing fluid intake orally or intravenously, and then, of course, monitoring the sodium lab values by doing a blood test. So, looking at this, the key message is that electrolytes inform clinical decision-making. Not only are the qualitative chemical compositions important, that is to say, yes, no in the presence of sodium and potassium, but the values themselves, the quantitative values that are inside or outside normal ranges, are critical to health. Sodium affects cardiac function, kidney, renal function. Same with potassium, in addition to managing the acid-base balance. Chloride is central to hydration, and particularly with osmotic pressure in the bloodstream. Calcium, again, kidney, renal function, and bone strength. So, electrochemistry implies a transfer of charge that takes place at the electrodes, and the charge is conducted through a bulk of the sample phase. This is the basis for measuring the concentration of the electrolyte in solution. Some fun facts. You can read these. Electrolytes are minerals that have an electric charge when they are dissolved in the water or body, including blood. The charge can be positive or negative. We see that the main electrolytes, we've talked about those. The adult's body is 60% water, which means nearly every fluid and cell in your body contains electrolytes. They regulate chemical reactions. Electrolyte problems are detectable using several different and varieties of lab tests. Testing usually involves a broader type of test called a metabolic panel. Right? That's an important one. Mass is a unit of how much. It's not the same as weight. The units of mass that are used are millimoles. Millimoles are the most constant and can be used for electrolyte atoms or molecules. And milliequivalents per liter are often used instead of millimoles. This is because milliequivalents take into account the strength of the ion's charge, which is why ions with stronger charges have different amounts than the same test results in millimoles. All right, clinical insight. Where do we get this? Where do we get the samples? And really, it really begins with a blood sample. The gold standard for electrolyte concentration in the body is blood testing. Urine can also be used as well as sweat tests, but there's some, in the case of sweat tests, they sometimes are an accurate measure of blood electrolytes. There are two prominent methods of measuring electrolytes: ion selective electrode and flame photometry. In the present work, we're just going to focus on ion selective electrodes. Electrolyte panels provide clinical insight. An electrolyte panel is a blood test that measures the levels of 7 electrolytes in your blood. Certain conditions, including dehydration, cardiovascular disease, and kidney disease, can cause electrolyte levels to become too high or low. Again, this is simply an electrolyte imbalance. An electrolyte panel is based on a relatively simple blood draw. Other names for electrolyte panel tests include electrolyte blood test, serum electrolyte test, and we see some basic metabolic parameters shown on the right-hand side. The differences between electrolyte panel and a metabolic panel, which are different, include that an electrolyte panel only checks electrolyte levels. A basic metabolic panel, BMP, measures the levels of certain electrolytes, along with creatinine, blood glucose, blood urea, nitrogen, also known as BUN. The relationship between electrolytes is important, and sometimes that's expressed in terms of what we call a fishbone diagram. This helps clinically in basically 3 ways. 1, visual representation provides a clear visual representation of values, in particular ratios. We've mentioned the blood urea and nitrogen and the creatinine levels, and having the values in this form allows you to very quickly look and compute ratios. It really is an organized structure too. The diagram organizes the different elements of the metabolic panel into categories: electrolytes, renal function, glucose metabolism. Kind of gives you an overview of all the different parameters that are important in patient care. And of course, problem solving. When abnormalities are detected in a patient's metabolic panel, the fishbone diagram can assist in systematically identifying potential causes or factors contributing to these abnormalities. To summarize what we just covered, basically, electrolytes are essential in clinical decision making. We've elucidated the role of electrolyte measurement in clinical decision making. Electrolytes, vital for cellular function, maintain fluid balance, nerve conduction, and muscle contraction. Significant role in controlling the patient homeostasis and identifying dysfunction, whether it's renal or dehydration, fluid volume deficit. So basically, timely electrolyte assessment guides treatment, aiding in diagnosing conditions such as electrolyte imbalances, acid-base disturbances, or kidney disorders. Hopefully, we've emphasized the pivotal role of electrolyte measurement in clinical care, highlighting its indispensability for informed decision-making. Thank you for your attention.